Hello everyone, I hope the videos are proving beneficial and meet your learning needs. Today we will read up on the high yield points from the gastrointestinal system. First, let's read the question. A 16-year-old male presents to the emergency with bilious vomiting and crampy epigastric pain after taking a meal.
The pain is temporarily relieved by lying on the side. His mother gives a history of weeks of nausea, vomiting, poor appetite, and weight loss. On physical examination, the patient has had significant decrease in his BMI from 23.5 to 19 since his last checkup a year ago. He weighs 45 kilograms to 60 kilograms a year ago, with a blood pressure of 90 by 60, pulse rate 92, respiratory rate 18, and he is afebrile. He looks cachectic, but there are no signs of jaundice or edema. Abdomen is soft palpation with mild tenderness in the epigastrium and reduced bowel sounds. An abdominal X-ray is obtained which shows dilated small bowel loops proximally. The CT abdomen reveals the distal duodenum nearly camped between the aorta and another vessel.
Which of the following vessels supply the involved portion of the duodenum?
A. Celiac artery, B. Gastroduodenal, C. Inferior mesenteric, D. Marginal artery of Drummond, E. Superior mesenteric artery.
We will dive straight into the anatomy of the GIT. The GI tract is divided into three parts based on embryonic development: the foregut, midgut, and the hindgut. The foregut includes the esophagus, stomach, proximal half of the second part of the duodenum up to the major duodenal papilla, the liver, gallbladder, pancreas, and spleen. The midgut includes the duodenum, distal half of the second part, jejunum, ileum, cecum, appendix, ascending colon, and proximal 2/3 of the transverse colon. The hindgut includes the transverse colon, distal 1/3, descending colon, sigmoid colon, and rectum. Here I have demarcated the boundaries on the right image. The gastrointestinal system relies on a complex network of blood vessels and nerves to function effectively. This table will help in memorizing the key components. Let's take a look. The foregut is supplied by the celiac artery, the midgut by the SMA, and the hindgut by the inferior mesenteric artery or the IMA. The nerve supply to these regions is primarily parasympathetic or sympathetic. The parasympathetic branches are derived from the vagus nerve and the pelvic splanchnic nerves, whereas the sympathetic branches are derived from the celiac plexus, superior mesenteric, and inferior mesenteric plexus. It is vital to know the spinal segments that supply these plexuses. Arterial supply is very high yield, and it is beneficial to know from where each artery originates and what their branches are. So the celiac artery originates anteriorly from the aorta at the lower border of the D12 vertebra. The superior mesenteric artery originates anteriorly at the lower border of L1 vertebra, whereas the inferior mesenteric artery originates anteriorly at the L3 vertebra. This image is helpful to understand how branches of the aorta look like. As you can see, all the branches to the GIT are single and central, while others are lateral and paired. Memorize the location of all these vessels labeled in the diagram. Let's take a deeper look into the branches of the arteries to the GIT. First, we have the celiac trunk. Here you can use the mnemonic LHS, or left hand side. L stands for left gastric artery, H stands for common hepatic or hepatic artery, and S stands for splenic artery. It's a little tricky to memorize this, but with spaced repetition and organizing this in a flowchart form helped me remember these. Next, we have the superior mesenteric artery. You can remember this by the mnemonic MRI, or my right index. M stands for middle colic artery, R for right colic artery, and I for ileocolic, inferior pancreaticoduodenal, ileal, and jejunal small branches. Here the ileocolic artery is important since it supplies two branches, the superior and inferior branches, and the inferior branches further give rise to the appendicular artery, the anterior and posterior cecal arteries, and an ascending branch. Then we have the inferior mesenteric artery. You can remember this by the mnemonic LESS. Inferior means less. LE stands for left colic artery, S stands for sigmoid, and S stands for superior rectal artery. Here is a summary showing the arterial supply of the GIT. Two important clinicals that you need to keep in mind include the superior mesenteric artery syndrome and the Nutcracker syndrome. The superior mesenteric artery syndrome is caused by a significant weight loss or malnutrition and usually occurs in adults who are thin and lean. It can also occur in the younger population who are undergoing a pubertal growth spurt. This is caused by the compression of the third part of the duodenum between the superior mesenteric artery and the aorta. It presents as severe crampy and intermittent postprandial pain along with early satiety. Management includes nutritional support with prokinetics and surgery in the case of dire circumstances. Nutcracker syndrome, on the other hand, is caused by congenital factors, excessive physical activity, or trauma. It is caused by the compression of the left renal vein between the abdominal aorta and the superior mesenteric artery. It presents as hematuria, flank pain, left varicocele, and proteinuria. Again, nutritional support, diuretics, and analgesics along with surgery are helpful. Here you can see a visual illustration of how the SMA syndrome happens and the Nutcracker syndrome. As you can see, the compression of the duodenum between the superior mesenteric artery and the aorta causes the superior mesenteric artery syndrome. On the other hand, the left renal vein also lies between the superior mesenteric artery and the aorta, just above the duodenum, and is also susceptible to compression, resulting in the Nutcracker syndrome. If you look at the question, here we have a 16-year-old boy who presented with bilious vomiting, looks cachectic, and has signs and symptoms that are depicting that he has partial obstruction of the small bowel. His X-ray shows dilated small bowel loops proximally, and a CT abdomen shows distal duodenum nearly clamped between the aorta and another vessel. So which of the following vessels supplies the portion of the duodenum? Since we know that the third part is compressed, that is supplied by the superior mesenteric artery. Feel free to go over the detailed answer explanations. Here is the key point from today. Just know the three arteries supplying various parts of the gut and you will be able to answer the questions easily. Thank you for listening. Please don't forget to like and share. If you have any suggestions or comments, feel free to email me and don't forget to hit subscribe.